Procellera antibacterial wound dressings are powered by V.Dox technology, employing a patented matrix of moisture-activated microcell batteries. They generate electricity designed to mimic the skin's internal electrical energy. V.Dox technology has been shown to kill a broad spectrum of bacteria while supporting the body's natural healing process. This video will provide brief instructions on how to use Procellera Composite antibacterial wound dressings. You will need the following sterile materials: Procellera antibacterial wound dressing, gloves, wound cleanser, skin prep, Energel wound hydrogel. Cleanse the wound area with an appropriate wound cleanser. If desired, apply skin prep to the area surrounding the wound. Remove Procellera from its package and peel back the center liner to expose the dotted Procellera pad. To activate Procellera's microcell batteries, moisten the Procellera pad with sterile saline, water, or a thin, even layer of Energel wound hydrogel. Hydrogel will help maintain moisture and battery activation longer than saline or water. If applying to a flat wound area, position the Procellera pad over the wound and gently press down to ensure direct wound contact. Remove remaining liners and smooth adhesive down over the skin. Position the joint in slight flexion. Peel back the center liner to expose the dotted Procellera pad and moisten as previously indicated to activate Procellera's microcell batteries. Position the Procellera pad over the wound and gently press down to ensure direct wound contact. Remove remaining liners and smooth adhesive down over the skin. Position the knee in slight flexion. Orient the dressing with the straight end at the thigh and the curved end at the shin. Peel back the center liner to expose the dotted Procellera pad and moisten as previously indicated to activate Procellera's microcell batteries. Align the Procellera pad along the surgical incision. Gently press down to ensure direct wound contact and adherence of the exposed adhesive. Next, remove bottom liners and secure flaps to skin. Remove top liners and secure flaps to skin. Ensure top flaps overlap bottom flaps. Tuck any excess material at the crease for best appearance. Remember that for Procellera's microcell batteries to remain activated, Procellera needs to remain slightly moist. Procellera may be left in place for up to 7 days unless otherwise prescribed. Earlier or more frequent changes may be required, depending on the amount of exudate present and the condition of the wound and surrounding skin. Consult a healthcare professional if any of the following occur: signs of infection, increased pain, redness, or swelling, increased bleeding, maceration, hypergranulation, irritation at wound or surrounding skin. Wound increases in size after a few dressing changes. To remove Procellera dressings, lift one corner of the adhesive layer and gently pull back, keeping the adhesive low and parallel to the skin surface. If the dressing adheres to the wound surface, moisten it with sterile saline or water until it can be removed without tissue disruption. Prior to use, please review the following indications, contraindications, and the instructions for use for a complete list of warnings and precautions.